Amber, as you can see, is a gorgeous girl, and most people would say, and a lot of injectors would also say, she doesn't need anything and send her on her way. But the way that I look at it, is there's very minimal things that are more preventative, and that's really what someone like Amber is going to benefit from. And again, what we're going to do today is very, very minimal filler. We've done some before on Amber. We're just going to do a little touch up today. And when I look at Amber's face, what I see is, again, very typical of women in their late 20s, early 30s, is that you start to get a little volume loss right under the eye, right in the cheek area. These lines start to become a little bit heavier, a little bit more apparent as we age. And I know that if this is left untreated, in a couple years, Amber would be walking in and paying a lot more money, needing a lot more product to really sort of lift this up and put it back where it's supposed to be. She'd have much more sort of facial sagging here, and so we really want to start preventing all of that now before it gets too bad. So today what we're going to do is just do a little bit of filler, a little bit of a hyaluronic acid right here, just increase her volume in her cheeks, just very lightly go over her nasolabial folds. Again, these are very natural smile lines. They shouldn't be disappeared on the face, but they can just be softened, again, just to give an overall soft, youthful look. This is a mix of hyaluronic acid with a little bit of lidocaine. I always mix all of my fillers with lidocaine so that it gets a little bit more comfortable as we're going along. And teeny tiny 30 gauge, 1/2 inch needle, very small, it's the smallest that we can use. So again, I'm just really going, if you turn your face to the side, you see it's just got a little bit of flatness there, and that's what I really want to kind of volumize and bring up. So go ahead and turn your face this way. You can close your eyes if you want. Little stick. How you doing? Oh, good. My patients are such troopers. Again, we're going down deep because we don't want to see this product on the surface of the skin. We really want to go almost under the muscle. A couple more pokes and we'll be finished. It's a relatively quick procedure. So we've done this eye. This eye is untreated, and again, it's not an obvious difference, but if you turn to the side where you can see a bit of a hollowness there, if you turn this way, just a little red, but you can see there's a much nicer fill there that is just, without being obvious and without really speaking that she's had any work done, because we're not trying to advertise that to the world. All it's doing is giving her back a fullness there so that she'll need a less concealer, she won't look as tired, and it just kind of, again, it's going to lift up a little bit of what's going on down here, and again, really with the eye of sort of preventing large amounts of loss to the cheek volume here. So we've finished filling in Amber's cheeks and her under eye area, and again, it's very subtle. I don't ever want any of my patients walking around looking like they've had work done. I tell my patients, if someone stops you on the street and asks you who did your Botox or who did your filler, that's a bad sign. So we're finished here, and again, she's a little bit red, she's a little puffy, and it will go down. But again, we just wanted to flatten her out, soften her out. Now I'm gonna just do a little bit of a touch up on her lower face, on what we call the nasolabial folds, or her laugh lines around her mouth. And the other area that is very commonly done on younger faces is what we call the marionette lines. And now we're going to go just a bit in the corner of her mouth. Sorry. Good, one more. That's a sensitive one. And so we're just going to do a little bit more here. Oh, sorry, babe. This is a little bit of a different technique that I'm using here because the line at this point is almost engraved into the surface of her skin. So sometimes what you have to do is go sort of right under the surface of it, really try to fill it out and hopefully build a little scar tissue along that line. So we're all done now, and so again what you see is very minimal softening to the hollowness under her eyes, just a little bit of softening to her nasolabial folds. This side is a little swollen because we had to do some more product over here and some very sort of superficial pokes right along that line, again because it's already at the point where it's getting engraved into her skin. And generally what I'll tell my patients, she may or may not need to massage it down. In a couple days, once everything sort of settles down and all of the swelling dissipates, she may need to massage it a little bit just to soften out the edges. So again, what we have is very, very minimal changes to her face. She doesn't look different. She doesn't look obvious. I mean, even now, with it being immediately after, you know, she can throw on a little concealer, go out, and in a couple days, she's gonna look really, really fabulous. And for us, this is really the name of the game, is getting to your face before you are really showing obvious signs of aging, doing minimal touches, minimal ways to accentuate the face and really make you look as beautiful and youthful and soft as possible.